Voices of Self-Funding podcast. I'm your host, Tom Testa. Each episode, I'm joined by leading self-funding experts for a deep dive into impactful topics and perspectives surrounding the self-funding industry. Our goal is simple: to give you practical insights you can put into action, whether you're a TPA, a broker, or an employer. Joining me today is Angel Anoja, the co-founder and CEO of Avelis Health, a company using AI agents to tackle one of the biggest hidden problems in healthcare: inaccurate medical billing and payment errors. Angel, welcome to the Voices of Self-Funding.
Thank you so much. Happy to be here.
I'm glad to have you here, Angel. I'd love to start with your personal story, because this wasn't just a business idea of Avelis that came out of nowhere. You actually lived through the frustrations of the healthcare billing system yourself. What happened, and how did that experience ultimately lead to where you and Avelis Health are today?
Yeah, so it's a really interesting time. So just context on myself. I played soccer my whole life. And so, as every soccer player, I had a ton of knee injuries and problems that came alongside with that. And so I've actually had three knee surgeries by now on the same knee. And obviously going through that entire process through the healthcare system has just been, frankly, a nightmare with trying to deal with prior authorization, why my things weren't being paid by my insurance, why I got denials, why I got bills that were incorrect, right? And it was extremely challenging to actually have to figure out all of these things by myself. And this was like the pre-ChatGPT days. I spent a lot of time trying to learn about what an EOB is and what an itemized statement is and how I can use those things to actually push back against some of the charges that I'm seeing. And that was the original idea, is that once I learned about AI, and this was like basically once ChatGPT came out, and I learned about these large language models and how you can use it for a lot of document processing and building things like voice agents that can call people on your behalf. I had this revolutionary idea where we could basically use AI agents to help people fight their medical bills. And so that's actually where we started out on the patient side, and then we ended up finding our way to payment integrity, which I can talk a little bit more about later. But that was a little bit about my personal story.
And it's a story that affects so many people. So to have that personal impact like that drive what you do today, it's something a lot of folks deal with. You've been on the front lines, and you continue to be on the front lines with a lot of the folks who are dealing with this medical debt as well. Talk to me. I want to dive a little deeper with you, Angel. You've talked about how medical debt in particular affects, speaking of affecting people, over 100 million Americans, and how a large percentage of medical bills contain errors. From your perspective, why is the healthcare billing ecosystem so vulnerable to mistakes and overpayments? What's happening?
So the core problem is that healthcare payment rules are written in human language, but the claims are adjudicated by software. And that's really the fundamental sort of difference of as to why you see so many errors, because there's this huge translation gap between what is actually in a plan document or what is actually in a reimbursement rule book
Mhm.
and what is actually being paid on a claim. Oftentimes for providers, the person who's actually delivering care is not actually the person who's writing the bill. And so you already have that discrepancy at the point of care. A lot of providers will outsource their billing departments. And so the people who are actually writing the bill as to what happened are just using their best knowledge of trying to guess what codes to use and what reimbursement payments look right. You might even have a sort of payment that looks technically valid and is correct, but because of very specific plan rules or coding guidelines or a contract term, it's actually not a correct reimbursement. It's such a complex financial system. There's so much difference between the codes and the diagnoses and the modifiers and the revenue codes that are being used versus how things should actually pay. There's a huge data problem as well. And so oftentimes the person who is actually paying the claim doesn't have information as to exactly what happened. So you're essentially paying blind.
Talk about that data problem. What do you mean by that?
Yeah, so if you're thinking about it, right, when you see a healthcare claim that comes in, there's only certain fields that are available. That might be the things that I mentioned before: CPT codes, diagnosis codes, modifiers, revenue codes. It doesn't actually have anything to do with what actually happened at the care site, right? So if any of those codes are wrong, you don't actually know that unless you were either there to actually physically view it, or you're looking at the medical records. The medical records don't come alongside the actual claim submission. And so you just have to basically trust that the person who's submitting the claim actually billed those things correctly. But a lot of times, just with the same data that I mentioned before, the CPT codes, the diagnosis codes, you'll find things that don't actually match up. They don't make sense clinically. And so it then begs the question of what actually happened during that site. The best example I love to use is if you were to go to a restaurant and they brought you the bill at the end of the day and they didn't bring you any itemized statements to see what you're actually paying for, right? And so you can trust that the restaurant bills you correctly, but then you also have to recognize that they're incentivized to charge you for things that you might not have actually consumed.
That's a great example. I feel like that's a lot of consumer-based examples too that we're seeing too much in healthcare. And that probably brings up the question of payment integrity, correct? That's what we're talking about now. And I'm really excited to explore that today with you and the use of AI agents specifically in payment integrity. Well, first, before we jump into it, define payment integrity. What does that mean to you?
The actual word of payment integrity, I think, does a really great job of describing what it is. It is making sure that payments are being paid correctly. There's a big philosophy in the industry that it's the payers versus the providers. And everyone always on the provider side says the payers don't want to pay for anything. And the payers always say that the providers want to charge for all these services that don't exist or want to upcharge. I don't think that's actually true. I think that the majority of the people in the industry want to just do things the right way. They want to be integral about the system. But what you'll find is that there's just a lot of confusion on the provider side as to what codes are the actual appropriate codes to use for given services that happened. And then on the payer side, there's a lot of confusion around what codes are actually applicable to specific sort of network arrangements, specific contracts, specific summary plan documents. And so there's this huge amount of confusion, like I mentioned, on both sides, to where that is what causes this industry to rise, where you need these third party players to come in and solely say, hey, we are just going to focus 100% of our efforts to make sure that these payments are paid correctly. If the provider is not being paid enough, then we want to make sure that's the case. And if they're being paid too much, we also want to make sure that's the case, right?
So let's talk about how those AI agents are being deployed to do just that, to audit claims, identify overpayments in real time. Talk about that.
So I think it would be really helpful to just level set on what an AI agent is. And so we define an AI agent as a self-reinforcing agent. So you can think of a self-reinforcing worker that can handle a task from end to end. That's very different from just what you might see on an LLM or a ChatGPT type of service, where you ask a question and you get an answer back. So that's a fundamental difference between AI agents. And so when we say AI agents are in the payment integrity auditing space, we are not meaning that we're using AI to then look through every single line. Because if we assign a plan that gives us 2 million lines of claims to go and audit, you're not going to make 2 million API calls to go and audit every single line. And so what we're doing with AI agents is we are essentially taking the reimbursement policies. And so that can be a summary plan document, that could be a medical policy, that could be coding rules, that could be a provider contract. There's a whole host of these legal documents that govern how claims should be paid. We're using AI agents to ingest that document and then to create a set of deterministic rules from that document that you can then run against your claims. The important reason for that is because of one, explainability and auditability, right? If you're just throwing AI at the given claim and say, make a decision, should it be paid, should it not be paid? That's a black box. That's obviously not something that you want to do. It's very expensive and it's non-deterministic. Fundamentally, large language models are non-deterministic. They can give you one answer today and another answer the next day, right? But if you're writing a deterministic script from the large language model, then you'll be able to see, firstly, what assumptions are being used. And so for us, we're able to say, hey, based on page 47 of your summary plan document, you say that this specific service is excluded. And so because of that, we're using that to write this specific script, which is going to check for this CPT code, these diagnosis codes, these modifiers. These are the exclusions that we're going to take care of because that's also listed on page 47, or that's listed elsewhere in the document. And then if you agree about all these assumptions, every single time that you run your claims against it, it's going to be adjudicated the same way. And that's super important for like the explainability and auditability piece. And so that's what we really mean around how we're using AI agents to deploy in the auditing process. And then I can talk about the recovery side of things that we're doing too with voice agents. I'm sure we'll get to that point a little bit later, but that's also really helping with provider communication and helping explain why the decisions were made as how they were made.
Let's get into that because that's a very interesting part of Ellis model is using voice AI to communicate directly with providers and manage recovery workflows on overpaid claims. How does that work in practice? Talk to us about that.
Absolutely. So it's the same thing, like I said before, you can think about payment integrity on two sides. So you can think about it prepay, postpay. There's a need for both in the industry. I know that the industry is very much moving towards the prepay side because everybody wants to stop dollars from going out before they do. But there's a real need to have post-payment auditing, especially in the cases where you need the medical record to see more information, right? Because claims have to be paid on a certain timeline. And so if you have to pull a medical record, that can take some time from the provider side. The claim needs to be paid now, right? So that means that there needs to be an opportunity to look at that post-payment. What that means for us is that we are totally and 100% against black box auditing. Everything has to be transparent. We cannot flag something as an error without being able to fully describe to the provider exactly why that error is happening and how they should then fix that error from happening in the future. Because that error might be just fundamentally how they train their medical coders on site, but then it doesn't actually align with this given payer's policy, for example, right? And so that's a very nuanced conversation to have. It's not something that you can automate through some type of deterministic system because every claim is very different. Every single scenario in which a patient had to go into the provider to get care is different. And the way that that sort of code is being prescribed to that patient is different. And so you need essentially a non-deterministic system that's able to reason over the circumstances of a case or of a sort of like a claim, and then be able to talk to the provider like a human does in English and be able to translate the code back into sort of human language for the provider to then understand. It might be like, hey, we have found that you have a sort of multiple procedure payment reduction on this given claim. That means that for this given radiology code, because you had these two services that happened in the same day by the same provider, the second service is supposed to be a 50% discounted payment. And so trying to explain that to the provider, they might already understand that given procedure, but then maybe for one insurance company, it's different than another. So maybe that provider is going to say, oh, well, we always bill like this and we've never had any issues outside of this specific employer. Why is it the case with this specific employer? And then you'll call and you'll say, oh, based on the summary plan document for this employer, their discount is actually 25% versus the typical industry norm is 50%. That's like a very specific case that you basically need to have some type of person or agent or whoever that can reason over the documents to be able to explain that to the provider so that there's no confusion as to why things were denied or why things are being recouped for payment.
That's fascinating. And this voice, this talking to providers like this, is this something that's not very common throughout the industry? Is this something that Just Avelis is doing right now?
The funny thing is that these voice agents are something that have only been good enough within the past year, I would say.
Okay.
And so these voice agents are actually able to have full conversations with the providers. We're making probably hundreds of calls per day.
Hmm.
And I trained it on my voice. So it's like super fun to hear back the conversations. And I think it's going to be really interesting because you also have a lot of people on the provider side doing the same thing on the RCM side, using voice agents to then call the payers to say, hey, this was denied. You need to follow back up on this. And it's a really challenging issue for the providers because oftentimes when payers are denying services, they don't actually provide reasons as to why they're denying them. Like I go back to what I was saying before, there's this black box, right? Because they have algorithms that deny the claims. They don't have AI that can actually explain that to the provider. And so there's nothing actually being fixed. There's just problems being created and work being created for the provider. But if you actually go to the provider, you can actually sit down with them, have a 20-minute conversation to explain, hey, this is what this is very specific to this employer group under this TPA. And this, anytime that you submit claims like this, it's going to be denied because of these specific reasons, right? That is something that's very appreciated by a provider because ultimately they just want to do their work and get paid for their work, right? And so having to then follow up after all these claims, figure out why they're not paid correctly, it's a massive amount of undertaking for them. And so you have this huge RCM industry that's risen up from it. You have a huge payment integrity industry that's risen up on the other side. I think eventually you're going to have voice agents calling and just talking to each other over the phone. And then the interesting thing is, do you even need English at that point, right?
Let's hear from the sponsor and take a quick break. You've been listening to incredible insights on the future of self-funding. But for you, the growth-oriented executive at a third-party administrator, a critical question remains. How do you turn these industry insights into market differentiation and real profitable growth? In a crowded market, winning new business against the big BUCA carriers is tough. You're constantly struggling with low member engagement and an overwhelming volume of tactical support calls. Zaki Point Health is your digital co-pilot for care navigation and growth. We provide a multi-touch mobile member experience that drives 3 times higher engagement rates and cuts your administrative burden. But we know you need more. That's why we built the Zara AI Suite to tackle your largest service challenge: routine provider and member inquiries. Using our voice, our portals, and AI bot technology, the Zara AI Suite cuts your provider call volume for routine benefits eligibility calls by up to 50%. This is a massive leap in efficiency and cost savings that directly impacts your bottom line. And the beauty of our platform is that it is integrated with your claims system to drive data-driven direction for members, providers, customer support reps, and employers. No more silos and questions about the integrity of your data. TPAs partnering with Zaki Point Health are experiencing over 20% year-over-year growth. We equip you with the differentiated tools to win new business, satisfy employers with clear ROI, and scale your operations. Stop struggling. Start competing and winning. Visit ZakiPointHealth.com today and request a demo to dominate the middle market. Let's get back into the show.
I want to switch gears just for a quick second. You mentioned LLMs a little earlier when we were talking. You've been vocal about how LLMs can actually be dangerous when it comes to payment integrity in healthcare operations. What concerns you most about organizations trying to use kind of that off the shelf, is that the same in the black box AI tools in this space? What concerns you most when it comes to LLMs and that stuff?
It's a really good question. I think the thing that scares me the most about people's use of LLMs, if you don't have a really good system around it, is around the deterministic auditability side of things. Like I mentioned before, LLMs can give you one answer one day and another answer the another day. And you can also have different LLMs give you different answers. And it's the same thing with humans, as just to be fair, if you're doing like a medical necessity check and you have one provider say that this service was medically necessary, you might have another provider say the opposite. 2 different doctors doing different training, whatever the case is. The case is very similar in agents. The problem with LLMs is that there's not a auditability standpoint of it. It's very black box, right? It's like send a question, get an answer back. That's the difference between LLMs and agents. Because with agents, you're using LLMs to automate one side of the process, but then ultimately that LLM is within a deterministic system, so that every time that you get this question answer approach, or every time that you have it doing one unit of work, you know that you can audit that unit of work every single time, and that unit of work will be the same as long as that system is built in the same way. That's, I think, the big reason to not use LLMs off the shelf, just because you'll get a wide host of answers. And in healthcare, where everything needs to be auditable, I think that's just unacceptable.
Just so I have this straight, so the AI agents they're overseeing the LLM? Is that how it works within the system?
So the AI agents use LLMs to be able to build a deterministic system.
Gotcha.
So that's what I was mentioning before around the LLMs are just one part of the agent. It is one tool that the agent has to use to be able to accomplish a unit of work. It also has a lot of deterministic tools as well that it can use to then accomplish that same unit of work.
So with all this has been a great conversation, Angel. It really has. And it always has to come back to this somewhere. We're applying AI, and then there's the whole AI to claims, medical records, security and PHI protection always becomes a big question with this. It's always on the, do I trust it, right? The trust factor, everything like that as well.
100%.
How do we approach data security, compliance, and trust when deploying these AI systems, these agents?
Yeah, no, it's a really good question. And so this is also a large part of the reason why it's a very scary world in healthcare. I was giving a talk the other day and I compared having the ability to access ChatGPT kind of like putting a marshmallow in front of a child, because you have such a powerful system and you're essentially telling your workers inside of your company, let's say you're a payer or provider, whatever the case is, that they can't put their information in the system to do their work. Because obviously, if you're using ChatGPT and you're putting sort of PHI in there, then ChatGPT is going to take that data and they're going to train on it. And so that's like a massive PHI data breach. It's completely unacceptable, can lead to lawsuits and things like that. And so that's the large part of the reason why you want to work with data vendors, because typically for these enterprise partnerships, you'll be able to then utilize data retention agreements with the large language models. You'll be able to sign BAAs with them. Any information that they pass, they make specific agreements to you that they won't train on your data. The biggest thing for us too is around strict access controls, strict audit logs, a clear separation between the customer data and model training, and also customer data within each other as well. We can never train generalized models on customer data. And so it's really around just being transparent around what you're actually doing with a customer's information, because I think this is one of the most secure industries in the US, I would say, in terms of if there's a leak, then you're pretty much finished. As definitely a small plan. And the larger plan, you're looking at billions of dollars in lawsuits from a leak. It can be very challenging to just want to use these incredible tools that are ahead of you, but then not thinking about the security side of things.
Absolutely, Angel. And also, too, the voice component of it, the voice to the provider, what adds the trust and value there? Here's Angel's voice calling me from the system, telling me I'm a provider, but there's got to be this security, there's got to be some trust value there, too.
Absolutely. Like I said before, it's really around the access controls and the audit
Mhm.
logs, right? So for any voice agents that we are building out, we actually have full access to hear back the conversation. We can actually read the entire transcript of the conversation. We also do auditing on the logs of every single transcription conversation to then not only improve the calls going forward, but then to also make sure that it's following a very strict guideline. And then the access controls are a very big thing. And so what happens in a situation where you're calling the wrong phone number and
Mhm.
then you have PHI loaded up into the system and
Right.
the person is trying to extract the PHI from the agent that's calling? What happens in a situation where you sort of called the right number, but then you've loaded all this PHI into the voice agent, and for some reason it's giving the wrong information for another customer instead of giving the customer that you're actually talking about? And so the only reason that you can prevent those things is through strict access controls, because agents are not 100% great at following instructions. They're almost like very intelligent toddlers, right? And they will, if you have in the system prompt to say, hey, don't release this PHI information, and then the agent finds itself stuck in a situation where it feels like the only way to move forward is to release the PHI information, it's going to release the PHI information. So then how do you prevent that from happening? The only way you can prevent that from happening is to actually just not give the agent the PHI information. And so you actually have to then build a sort of like very sophisticated system where you have an intro agent to start off the call that doesn't have any access to PHI information. And then once the agent then identifies the right person on the call and they've identified the right client and the right sort of customer that they're supposed to be speaking to, then they pass off the call to an agent that then has the PHI information that's loaded only for that one specific case for that one specific provider that you're listening to. And that means that you need to have not only that agent who's calling, but then you need to have almost a supervisor agent who's listening into the call and making sure that everything is going correctly and will be able to then handle the transfer offs between the different agents on the calls. And so it's a very complex system that you have to architect, not just this idea of let me vibe code a quick caller agent that can just go and start calling all these hospitals and I'll just give it access to my whole database. And if someone asks a question about it, it'll have access to it, right?
I'm glad you ran through that because I don't think anyone thought it was so simplistic, but to see those layers, those levels like that, it's great to hear that that's what goes into this.
It's not the normal cases that you are
Mhm.
thinking about. It's the edge cases that create problems in healthcare. And so it's the edge cases that you have to really design around it. That's where the security problems really come from.
Angel, I've got one more question for you. This has been an awesome conversation. I really can't thank you enough for joining me today. What do you think, and this is when I tie this back into the self-funding industry, putting you on the spot here. What do you think the self-funding industry gets wrong potentially today about payment integrity and healthcare spend management?
That's a really good question. So I think I have quite a few different views on this. I think for one, there needs to be a more serious obligation of fiduciary responsibility on behalf of the third party administrators. I think what you find, and this is not to call out anybody in the industry at all, but
Right.
I think what you'll find is that TPAs will actually recognize that there is serious faults in the adjudication engines that they're using in order to process claims. But because TPAs, it's not necessarily their money, oftentimes you'll find that they're not willing to spend extra resources to do the payment integrity piece of it. because ultimately the employer is not necessarily aware that there's so many problems leaking through with their claims because that's what they hired a TPA for, right? I hired somebody to adjudicate my claims for me. I assume that they're trained in making sure that there's no leakage going through. On the TPA side, there's no incentive really to do a better job for your employers unless your employer is aware that you are not doing the job that you're supposed to on the payment integrity side, right? If the employer is not aware of that and you're aware that the employer is not aware of that, then you have such limited resources, you're going to have to spend time elsewhere in the business doing things that the employer is aware of because you'll recognize that that is what is leading your revenue and retention. So for one, I think TPAs need to have a more serious fiduciary responsibility to understand that, yes, they actually are on the line for payment errors that come through. And then I think the second piece on the payment integrity side, and this is, again, not to call out any other vendors in the industry, but I don't think that there's a good enough provider education job being done. And I think it's for a few reasons. For one, it's very challenging because you have to spin up a ton more resources in order to be able to actually sit down on the phone with a provider for 20 minutes and to explain to them exactly why the way that they're submitting claims for this specific summary plan or this specific TPA is just not being paid, right? So that requires a lot more resources. But then secondly, there's a misalignment of incentive because as a payment integrity vendor, I profit when I find more errors. And so it's almost in my best interest to make sure that those errors continue to happen. And that's what generally drives up the cost in healthcare because you have these errors that happen, then those errors have to get pushed back on, and then that raises the prices for other people because then the providers have to increase their prices every year because then they say the payers are denying everything. And then because the prices are going up, the payers then say, oh, well, look at the prices going up. I have to raise premiums. And then consumers are the one that ends up holding the bill. So I think there's just such a misalignment of incentives across the self-funded industry where everybody is just saying, it's not really my responsibility. I need to pass it on to the next guy. Or we're here to adjudicate the claims, but it's not really our it's not really our prerogative to spin up a bunch of these extra resources to make sure that things are being done correctly. And I really think that this is where AI is going to change the story here, because I think that you have found that it's not here to replace people and to make sure that everyone is out of a job. But if you go and you ask 10 TPAs if they think they have enough adequate resources to run their plan correctly, I think you'll get 10 no's from those 10 TPAs, right? And so you actually need a tool that's going to allow these TPAs to be massively more effective and to be able to do 10 times more work with the same amount of people. And I think that's what the AI story is delivering.
Angela, Noah, this has been an awesome conversation. I can't thank you enough for joining me. Thank you so much.
Of course. Sorry for being super long-winded on this. I have so many different thoughts on these things.
No, I know. And it was so great we got to have this entire conversation. Having you deep dive into this was excellent. We jumped around. We could have probably a discussion on just one of these topics. So it's great. We appreciate you doing this for us.
Absolutely.
If you'd like more information on Avelis Health, visit their website at avelishealth.com. You can also connect with Angel on LinkedIn. That's all the time we have for today's episode of Voices of Self-Funding. This program is brought to you by the Healthcare Administrators Association. For over 40 years, HCAA has supported third-party administrators and the self-funded insured employer industry through unmatched educational opportunities led by industry experts. To learn more about becoming a member, visit hcaa.org. Be sure to like and share this podcast on your favorite platform so we can continue to grow a community of like-minded professionals. I'm your host, Tom Testa. Take care, everyone.